You've probably heard the term intra-abdominal pressure, or IAP as it's often called. Heck, you've probably actually used it in conversation many, many times, but do you know exactly what it is? Can you define it precisely? In this video, I'm going to do just that. I'm going to talk about the anatomy involved in the creation of intra-abdominal pressure. I'm going to talk about how it's generated, and I'm going to define exactly what it is. In order to understand intra-abdominal pressure and what it is and how it's generated, we have to first cover the anatomy. And while there's a lot of muscles involved in trunk stabilization, from the lats to the psoas, the erectors, the abdominal wall, everything, I really think of it as that there are three primary muscles involved in stabilizing the trunk: the diaphragm, the abdominal wall, and the pelvic floor. So if we look here from the side, and you've got our pelvis here, and we've got our rib cage here, the diaphragm is going to be a dome-shaped muscle that separates the chest cavity from the abdominal cavity. I mean, it literally envelops both sides. So you're going to have it attaching to the rib cage, it attaches to the spine in the back, and it actually attaches up in the front by the sternum. That muscle, when it contracts, is going to pull the central tendon down towards the pelvis, and that's actually how you take a breath in. The central tendon comes down, opens up the lungs, and then air goes into the lungs. The abdominal wall is really kind of broken up into three main structures. So you have the six-pack muscle, the rectus abdominis in front, that actually just adds support to the insertion of these other muscles I'm going to talk about. But really we want to think of the abdominal wall is going to be broken up. You have the deepest layer is your transverse abdominis, right? And that's going to run from the spine and the pelvis and wraps just perfectly horizontal around the torso. So the transverse abdominis sort of runs this way. Then you're going to have your internal oblique, and the internal oblique runs from the pelvis actually up and in like this. And then you have your external oblique, and that's going to run from the rib cage down and in. So that's a confusing photo, but you basically have this corset of muscle fibers wrapping in all different directions from the spine all the way around to the front and connecting the rib cage to the pelvis. So they're incredibly capable of stabilizing, creating, and controlling motion of the torso in all different directions. And finally, you have the pelvic floor, which the pelvic floor is also divided into several muscles that are going to work like a diaphragm, just like the thoracic diaphragm, but they're on the other side here. So those are going to be the primary muscles of stabilization: the diaphragm, the abdominal wall, and the pelvic floor. Really, if you want to break up the abdominal wall, transverse abdominis, internal oblique, and the external oblique. Those are what create your sort of oblique slings we oftentimes talk about. So if those are the three primary muscles of stabilization, you might have noticed that I didn't mention the erector spinae or the psoas, or the posterior chain. And oftentimes in rehab and strength training, we hear people harping on how important these muscles are to core stabilization. And while they are absolutely important to core stabilization, they're accessory to the process. And what I mean by that is the primary muscles of stabilization, diaphragm, abdominal wall, and pelvic floor, should be doing most of the work. And these are the muscles that are responsible for creating intra-abdominal pressure. The erector spinae, or the posterior chain in general, is absolutely critical to spinal stabilization when these muscles cannot stabilize the trunk adequately. So when these muscles, the contractile force of those muscles, and the intra-abdominal pressure that they generate is insufficient for the task, let's say that you're doing a heavy deadlift or a max effort clean, then we need accessory muscles. We need your erector spinae, your latissimus, your glutes, your psoas, all these other structures to increase the stiffness of the trunk. Now, ironically, those muscles that we oftentimes see coaches and PTs and chiros, emphasizing in the training of the core are causes of lower back pain and injury. It's actually a compensatory strategy that I call an extension compression stabilizing strategy that I cover in other videos that is really overemphasis or overactivity of the posterior chain. So what we want to be doing in optimal core training is use the diaphragm, the abdominal wall, and the pelvic floor, the primary muscles of stabilization, to create intra-abdominal pressure. So what is intra-abdominal pressure? Is it this mysterious, enigmatic force in the abdomen? Is it a gaseous force? Is it something else? I've asked this question many, many times, over the years to engineers, biomechanists, physiotherapists, chiropractors, PhDs, all over the place. And the answer is typically the same, When I ask them what is intra-abdominal pressure, they tell me it's pressure within the abdomen, which is technically an answer, but it's a circular definition, so it's not very helpful. Well, when we think about the primary muscles of stabilization, what intra-abdominal pressure is, the precise definition of it, is really nothing more than the resultant force of the diaphragm and the opposing trunk musculature. So to understand what it actually is, I think covering how it's created is going to help. So we have the diaphragm right here, right? And that's going to, remember, it's a dome-shaped muscle sitting beneath the chest cavity and the abdominal cavity. And when that muscle contracts, it pulls its central tendon down towards the pelvis, caudally, right? It pulls it in a caudal direction. And that essentially is going to create an outward pushing force in the belly, right? So you have the abdominal wall here, the pelvic floor there. And when the diaphragm contracts and comes down, it's going to compress and push the abdominal contents forward against the abdominal wall, backwards against the spine, and even downwards against the pelvis, right? So that's the linchpin event, if you will, the diaphragm contracting, creating the outward pushing force. But then the abdominal wall and the pelvic floor, and even the passive structures like the pelvis and the spine, are going to resist that outward pushing force. And that outward pushing force and then the resistance provided by the other structures of the torso creates intra-abdominal pressure. So intra-abdominal pressure is nothing more than the summation of the contractile forces of the diaphragm and the opposing trunk musculature. That's it. So it's really nothing more than the diaphragm is sort of pushing the abdominal contents out in all directions, and then you have the abdominal wall and these other structures resisting that, right? So you have the diaphragm pushing one way, and you have the abdominal wall of the pelvic floor pushing back against it, and it's the result of those forces, the summation of those forces, that produces intra-abdominal pressure. So if we look at this from a different angle, you'll actually see why intra-abdominal pressure is so critical to spinal stability. If we sort of look here from the top down, if this is the spine, and let's say that we're just looking through sort of like a transverse cut through the abdomen, the diaphragm, when it contracts, it's going to produce an outward pushing force. So it's taking the abdominal contents and it's pushing it out against the abdominal wall, down against the pelvis, and most importantly, it's actually going to push it back against the spine. So it's these arrows back here that are so critical to spinal stability and spinal health. Now, when you have the diaphragm creating that outward pushing force, that is a necessary action, but it's not sufficient to create intra-abdominal pressure. If the abdominal wall just sort of succumbed to that force and expanded, you're not going to have a very significant change in intra-abdominal pressure. But in moments where we're trying to maximize the amount of pressure we're creating, now the abdominal wall in this case, because we're looking at a transverse cut, the abdominal wall is going to sort of increase its contractile strength, and that's going to provide resistance to the diaphragm. And the diaphragm force, the outward pushing force, plus the resistance provided by the abdominal wall and the pelvic floor results in intra-abdominal pressure. So when you have a really, really good stabilizing event that we're going to cover in subsequent videos and how to actually activate the core and how to train the core, you need to feel, one, an outward pushing force in the belly, and two, you really want to feel the pressure pressing back against the spine. So while the definition, the precise definition of intra-abdominal pressure is the summation of the contractile forces of the diaphragm and the opposing trunk musculature, I really want you to think of intra-abdominal pressure as an outward pushing force in the abdomen. Now, that's an insufficient definition, or an incomplete definition, but it's critical because you need to feel, or your athletes need to feel, an outward pushing force in the abdomen in order to brace correctly. Remember that an optimal brace is going to maximally leverage intra-abdominal pressure in the process. If you don't feel an outward pushing force in your abdomen, that means the diaphragm is not involved. If the diaphragm is not involved, then the bracing strategy is inadequate and you're using a compensatory strategy that might limit performance, it's going to block movement for sure, and it might even increase your athlete's risk for injury. In review, intra-abdominal pressure is the summation of mechanical forces produced by the diaphragm and the opposing trunk musculature. The diaphragm must first contract, pulling its central tendon down, creating that outward pushing force in the abdomen. And then the abdominal wall, the pelvic floor, and even the spine must resist that outward pushing force to create intra-abdominal pressure. Now, intra-abdominal pressure is the foundation of a high quality optimal brace, if you will. And in subsequent videos, I'm going to show you how to properly activate that. So how to learn how to create intra-abdominal pressure and brace in a way that maximally leverages intra-abdominal pressure. And then we're going to show you how to actually train the core. So be sure to click and subscribe.